Hey, it's Dr. Giganti, founder of the Back Pain Center and author of Hope and Help for Back Pain. This video, I'm going to talk about posting and how you can employ whether you're a flexion or extension patient. Remember, flexion extension, the book looks at two types of patients, flexion extension. The extension type patient is the patient that tends to be a little younger and still has the ability to bend backwards, where the flexion type patient is now the older patient where bending backward tends to be a little painful. And in the book we talk what exercises are better for which type of person you are. But posting is something that can be used by both types. Posting is when when you're seated. First, let me tell you something about sitting. There's nothing good about sitting. Even when you buy a $2,000 orthopedic chair, it only makes sitting less bad. It doesn't make sitting good. So posting is a way of sitting and employing motion to the back. So if you're an extension type patient, you're young, you like walking feels great, you feel better standing and all that stuff, then posting you would do is where you would really, what you do is you keep your shoulders still, but you're going to bend forward as much as you can, and you're going to do that. When you're driving long distances, every 15, 20 minutes, do 10 or 15 of these. The body loves motion. So if you're an extension type patient, like I said, you're young, you still have flexibility, your discs aren't dried out, you don't have much arthritis, then this is the type of motion you want to do, where you come all the way forward, employing motion in the car or while you're seating at job. If you're a flexion type patient, the spine still loves motion, except if you do too much forward, you might irritate it. So your flexion, you're going to focus more about bending backwards, straight, backwards, straight, backwards, straight. That's the flexion. The older patient who tends to have stenosis, arthritis, disc degeneration, things like that, you're going to go back, straight. The extension type person where it has more flexibility, maybe has a more gel to the disc, where there may be more of a herniation, would tend to do more forward, straight, forward, straight. So again, the extension puts more emphasis forward, the flexion more emphasis backwards. By the way, in the book, you're going to come across something called a pelvic tilt. That's where you're on your back, your legs are bent, and you're doing this pelvic tilt while on your back. So this is the type of patient where a flexion patient would you're going to push the lower part of your back into the table. So that's your pelvic tilt. So the pelvic tilt is really just this same thing as the seated thing, but on your back. So I hope you find this helpful, and we'll talk to you soon.